Welcome to In Other Words, the UCLA Tarjan Center's Plain Language podcast. In this episode, we interview speakers from our distinguished lecture series. I am Holly Oliver, the disability rights advocate at the UCLA Tarjan Center, and I will be your host for this episode. For more information, please visit our website, tarjancenter.org, that is spelled Tarjan, center.org. I want to welcome Dr. Claudia Dunn. Dr. Claudia Dunn is a visiting professor at San Diego State University. She's also a leading researcher in social emotional learning, or SEL, and educational equity. Dr. Dunn advocates for immigrant families of children with disabilities. She works to increase culturally and linguistically diverse, or CLD, parent involvement in individualized education programs, or IEPs. CLD means people from different cultures, backgrounds, and languages other than English. Dr. Dunn works to empower vulnerable populations at risk for harm. She focuses on special education, and she uses the SEL, social emotional learning strategies. The SEL builds student resilience and the ability to handle challenges, mental health, and success. Dr. Dunn has published many articles. She is presented at both the national and international conferences. She shares her expertise on SEL, equity, and inclusion. Through her work, she helps educators and communities. She gives them the tools to create an inclusive environment. This is a supportive learning environment where all students can thrive. Before we start, thank you so much, Dr. Dunn, for joining us today.
Thank you so much. It's my honor to be here. I really appreciate it.
Your lecture about your research on immigrant families in Houston, Texas, facing big challenges in special education and the IEP process raised many concerns and confusion about the lack of accessibility for these families. We all want to learn more about this important topic. What are culturally and linguistically diverse, or CLD, families? And what did your research show about their inclusion and participation in IEP meetings, and why does this matter?
Great, thank you for your question. This is a great question. Culturally and linguistically diverse families are families whose cultural backgrounds, languages, and lived experiences differ from the dominant culture represented in many educational systems. So this often includes immigrant families, families who speak languages other than English at home, and families whose values and communication styles may differ from those commonly expected in the US. In my research with Latinx immigrant parents of children with developmental disabilities, parents that participated in the individualized education programs, the IEP meetings, they reported feeling uncertainty about the process, struggling with complex terminology, and facing language barriers. That was one of the biggest one. And language barriers made it difficult to fully understand or engage in their decision making. Some of them also even describe experiences of discriminations or misconceptions about their knowledge or involvement as parents. And as a result, although parents were physically present in the meetings, their perception was not always meaningful or empowered. This mattered because federal law emphasized the importance of parent participation in special education. The IDEA mandates parents to participate in the IEP meetings. However, participation is not just about being present in the room. It is about having the knowledge, the confidence, and the opportunity to contribute meaningfully. And when these culturally and linguistically diverse families face these barriers, inequities in the system can be reinforced. So supporting culturally responsive communication, accessible language, and a stronger relation between families and schools can help ensure parent voices. And these parent voices need to be heard and valued. When these families feel that they're heard and valued, we create more equitable and responsive support for these families and their children.
So true. We need to include these families more than ever.
Yes, exactly.
What is social and emotional learning, or SEL, for those of us that need a simple explanation.
Yes, thank you. So, social emotional learning is the process and skills through which people learn to understand and manage their emotions, build healthy relationships, make responsible decisions, and show empathy towards others. So in school, social emotional learning helps children to develop skills like recognize their feelings, communicating effectively, resolve problems, and working collectively with others. So at its core, social emotional learning is about helping people develop their emotional and social skills they need to navigate life, build responsible decisions, positive relationships, and succeed both in schools and in their communities. So, in my work with families and children with disabilities, I emphasize that social emotional learning is not only important for students, right? But it's also very important for families and educators because supporting children with disabilities happens within relationships and communities. So that's why it's very important to include social emotional learning in the community.
That was very helpful.
Thank you.
What are the 7 barriers or themes or things that prevent parents from having success in the IEP process?
Great, thank you for your question. So in my research, Latinx immigrant families with children with disabilities, parents they describe 7 main barriers that made it difficult for them to fully participate in the IEP process. So one of them was parent insecurity of knowledge. Many parents felt unsure about their understanding of special education and questioned whether they had the expertise to speak up during those meetings. So they had no idea what special education meant or what their child needed. Another thing that came out was difficult terminology. So we usually, when we write an IEP, we write very in legal terms. So parents felt that it was very complex wording and legal language that it was very hard for the families to understand. The third theme that came out was confusion in the IEP process itself. So many parents described not feeling fully understand how decisions were made and what rights they had or what steps needed to be next. So first they were like, I didn't know that I had to be at the IEP, who was gonna be there, what we were gonna talk about. So they felt confusion in general at the IEP process. Another theme that came out was discrimination and misconception. So some parents felt that because they were from different cultural backgrounds or immigration status, they were not taken into consideration to make decisions. The fifth theme that came out was language barriers. Language barriers are when families are not fluent in English, and specifically for this research, these families were immigrant families, non-speaking English families. So this was very hard for the families to engage meaningfully in conversations about their child's education. So that was one of the barriers they had because they didn't have an interpreter or a translator during the IEP process. And even though some of them had a person that it was translating for them, they felt that some of the people that were doing that, they didn't have a lot of empathy towards them. So that made it more difficult. The other one that came out, number 6, was parent advocacy. So parents often felt that they were the ones that they had to push, they had to do everything they could to support their kids. Even if they didn't have the knowledge, they had to ask other parents, they had to look for resources by themselves because some of the educators or administrators didn't point them in the right direction, or they felt more comfortable asking other parents in similar situations than asking the educators. Even one parent mentioned that she went to the classroom to talk to the general education teacher about her son. And I remember she said that they built two doors, or the classroom had two doors. And she was concerned because her child was by the door, and her child could get out. But she went to ask the teacher how's her child doing, and she said that the teacher had no idea that her child had a disability. So that was very interesting to hear. So she had to advocate for her son. And the last thing that came out was some parents perceive lack of knowledge among some staff members or administrators about culturally, linguistically diversity, and which sometimes led to misunderstanding or limited communication with families. So together, these barriers show that even though parents are invited to the IEP meetings, their participation is not always fully supported. So addressing these barriers are essential to creating more equitable and collaboratively special education systems.
That was very fascinating, and I agree.
Thank you.
How can educators and professionals do to improve and provide equity or equal treatment for those CDL families?
Yes, thank you for your question. So I think we can improve research and policy by centering the voices of lived experiences of families, particularly those families from culturally and linguistically diverse backgrounds. So too often policies are designed without fully understanding how families experience educational systems in practice work. And I feel like in research, we need to use more approaches that actively include families as partners, not just as a participant. So listening to their experiences, listening to what they have to say will help us as a researcher identify barriers and strengths that may otherwise be overlooked. At the policy level, I feel like it is important to ensure that policies go beyond simple, by requiring parents to participate. So instead of just focusing on asking parents, you have to participate, so it needs to be a meaningful engagement. So this can include a stronger communication, language support, cultural responsive practices within schools. This can include training educators, professionals, so they can better support these culturally and linguistically diverse families to recognize those families emotionally, socially, and their cultural dynamics, so that can shape the family engagement and the community engagement. So I feel like by improving research and policy requires the question that we need to ask, instead of, because I feel like we always ask how do families fit into the system? So instead of asking that, we need to ask how can systems better respond and support these families.
I believe this will help a lot of people, and those are very great, valuable points to advance this type of research.
Thank you.
Last question is, what are the key takeaways you would like us to know?
Yes, thank you for your question. So there's three things that I would like to highlight. So first, and one of the most important ones, is that family voices matter. So parents and children with disabilities bring very deep knowledge about the perspectives and how meaningful the special education is for them. So we need to center family voices to create meaningful and effective educational supports. The second thing I want to highlight is that participation is not the same as inclusion. So even though families may be present at the IEP meetings, but we have a lot of barriers, like I mentioned before, such as language, terminology, power dynamics. So those things can prevent families from participating fully at the IEP process. So creating equitable systems means ensuring families feel informed, prepared, respected, heard, and empowered to contribute to the system. And the third one I want to point out is that equity requires relational work. So community, families, educators, all of us need to be together to create that relationship. So by building trust, we can create accessible communication to the families, and we can recognize those culturally backgrounds and emotional strengths that can transform the schools and the families. So the families are the center of this special education. So looking at these families, we can create more inclusive systems to better support children with disabilities and the community.
These are all great ideas for improving the process for these families. Thank you. You taught us that when we center family voices, we don't just improve systems, we begin to heal them. You also taught us that it's important to value the parents' voices, recognize their social and emotional needs, reduce barriers so that these families may be seen, heard, respected, and empowered. Thanks again, and see you all next time.